Well, certainly a lot of focus this week on weight loss. For many, it is a lifelong challenge, a constant struggle. And this week, we've been talking a lot about the different programs and the services that are available. This morning, we wanted to bring in Rachel Forbush. She is the clinical educator for the Bariatric Department at the Johnson City Medical Center. And Rachel, we thank you so much for coming on the show and joining us. Well, certainly this is that time of year where everybody's really thinking about making that big change. And when we talk about the surgery that you obviously have been talking with a lot of people about, this can be an option that can help a lot of people make that lifelong change.
Absolutely, because for some people in the community, they gain and lose the same weight over and over and have the inability over a long time to keep that weight off. So for that population of our community that's considered to be severely obese or morbidly obese, having bariatric or weight loss surgery is definitely a viable option and can be life-saving and is life-changing.
Absolutely. And you say it's also something that shouldn't be taken in lightly. This is a huge decision and it changes everything around you.
Absolutely. If someone is considering doing bariatric surgery, of which we do 2 different types at the Med Center, our big push for them is to understand going into this procedure what is expected of you before, during, and after. Weight loss surgery is not just something you go into, have it done, and then revert back to old ways and old habits. To be successful, this needs to be considered as a tool. And with this tool, you use this tool through behavior modification, lifestyle changes, healthy cooking, healthy eating, and you will be successful if you follow the plan and take personal responsibility.
And you have a little pamphlet here that I was looking through, and it talks about one particular story, and it talks about how important it was for her to continue that care, to continue that support, and that's one of the things that you offer.
Absolutely. This is Holly, and she is one of our participants and has lost over 200 pounds. And we have, what she thinks has really helped her as well, is we have weight loss surgery support group that meets once a month. And through that program, we bring together prospective patients as well as those that have already had the surgery, and we focus on struggles that maybe each group has, and they help each other out. So it's a great networking amongst the community members that are going through this. Also at the support group, we have a registered dietitian. I'm there as the clinical educator. We have a behavioral therapist, because again, this is not something you enter into lightly. A lot of thought needs to go into this. You have to be ready to make the change, and you have to meet a certain set of guidelines to qualify for bariatric surgery.
And it's not just about the emotional part of it, but the physical well-being of a person. I know a lot of people think that it's about that appearance, but it's also about positive health.
Great point, because we tell our participants this is not to go into for cosmetic purposes. With a lot of these individuals, they have what's called comorbidities due to the extra weight, high blood pressure, type 2 diabetes, as well as others. And with this surgery and the weight loss, we've seen many patients be able to decrease and go off some of their medications. So actually, we are increasing years to their life, their longevity, as well as their quality of life.
And for them, I know, listening to their different stories, being able to really get their life back and do things that they haven't been able to do for years.
Yes, and a part of my job that is very, very rewarding is watching this process from someone who just begins to become interested to someone that is in my pre-op teaching class, through the surgery, discharge teaching, follow-up. We follow that journey. So they have a great support system within the bariatric program at the Med Center,
which is so important for that continued success. Rachel, thank you so much for joining us. Interesting to learn more. If you are interested or would like to learn more, here is a website and a phone number you can always call for more information. Thank you.
Thank you.